My respected students, welcome to today's class. My name is Dr. Fahmy, and I'm delighted to have you all here as we explore the intriguing topic of sex differences in sport and exercise. Throughout this presentation, we will delve into various aspects such as hormonal influences, muscle composition, endurance capacities, and the impact of these differences on training and performance. Our goal is to gain a comprehensive understanding of how these factors contribute to the diverse experiences of athletes and exercisers across different sexes. I encourage you to engage with the material and actively take note as we navigate through this important topic together. Let's get started. As we begin, let's delve into the foundational aspects of sex differences in sport and exercise. Historically, societal norms, athletic governing bodies, and physical education curricula have perpetuated the myth that girls and women should not compete in sports. This long-standing bias has significantly influenced the opportunities and perceptions surrounding female athletes. However, the last 30 to 40 years have witnessed remarkable progress. Girls and women have broken barriers and achieved extraordinary feats in various sports. Despite this progress, notable sex differences in performance persist. These differences are complex, arising from a combination of biological and non-biological factors. Our objective today is to untangle these factors. We'll explore how hormonal differences, muscle composition, and endurance capacities contribute to varying athletic performances between men and women. Additionally, we'll consider the impact of social, cultural, and environmental influences that shape the experiences of male and female athletes. By understanding these nuances, we can foster a more inclusive and equitable environment in sports and exercise. Let's move forward and examine these intriguing differences in detail. In understanding sex differences in sport and exercise, body size and composition play a crucial role. These differences are largely driven by hormonal variations, primarily testosterone and estrogen. Testosterone, which is present in much higher levels in males, has several significant effects on the body. It increases bone formation, resulting in larger bones, and enhances protein synthesis, which leads to larger muscle mass. Additionally, testosterone boosts the secretion of erythropoietin, EPO, a hormone that increases red blood cell production. This contributes to greater oxygen-carrying capacity and endurance in physical activities. On the other hand, estrogens, which are more prevalent in females, lead to increased fat deposition due to the activity of lipoprotein lipase, an enzyme that facilitates fat storage. Estrogens also cause bones to grow faster but for a shorter period, resulting in a generally shorter stature and lower total body mass in females. As a result, women typically have a higher percentage of body fat compared to men. These hormonal influences create distinct physical characteristics between the sexes that impact athletic performance. Men tend to have advantages in activities requiring strength and endurance, owing to their larger muscle mass and higher red blood cell count. Conversely, the higher body fat percentage in women provides advantages in sports where buoyancy is beneficial, such as swimming. Continuing with our discussion on body size and composition, let's focus on the distinct patterns of fat deposition in females. One of the most notable differences is the specific areas where fat is stored in the female body. Women tend to accumulate fat more rapidly on their hips and thighs. This pattern is primarily driven by increased activity of lipoprotein lipase, an enzyme that promotes fat storage in these regions. This characteristic fat distribution is often referred to as the gynoid pattern, which contrasts with the android pattern seen in men, where fat is more likely to accumulate around the abdomen. In addition to this storage pattern, women experience reduced lipolytic activity, meaning the breakdown of fat is less efficient in these areas. As a result, regional fat loss, particularly from the hips and thighs, becomes more challenging for women compared to men. This reduced lipolytic activity is influenced by hormonal factors, especially estrogen, which regulates fat metabolism and storage. Understanding these differences is crucial for developing effective training and nutrition strategies. For example, exercises and diet plans targeting fat loss in women may need to be tailored to account for these physiological characteristics, emphasizing overall body fat reduction rather than spot reduction, which is less effective due to the body's inherent fat distribution patterns. By recognizing and accommodating these differences, we can support both male and female athletes in achieving their fitness and performance goals more effectively. let's proceed to explore further aspects of sex differences in sports and exercise. Next, let's delve into the differences in muscle strength between men and women. Research consistently shows that there are significant disparities in strength, particularly when comparing upper and lower body capacities. In terms of upper body strength, women are generally 40 to 60% weaker than men. For lower body strength, the difference is somewhat less pronounced, with women being about 25 to 30% weaker. These differences are primarily due to variations in total muscle mass between the sexes. It's important to note that these strength differences are not due to any fundamental differences in the muscle tissue itself. The mechanisms of muscle contraction and function are the same for both men and women. The disparity arises mainly from the larger muscle mass in men, which is influenced by higher levels of testosterone that promote greater muscle hypertrophy. Interestingly, when muscle strength is expressed relative to muscle cross-sectional area, there is no significant difference between the sexes. This means that, pound for pound, a unit of muscle in women is just as strong as a unit of muscle in men. This highlights that the intrinsic quality of muscle tissue is comparable between sexes, and the observed differences are predominantly a factor of overall muscle volume and distribution. To better understand the upper body strength disparity between men and women, it's essential to examine the underlying causes. Several factors contribute to this difference, providing insights into how muscle distribution and function vary by sex. Firstly, women tend to have more muscle mass in their lower bodies compared to their upper bodies. This distribution is a key factor in why there is a more pronounced disparity in upper body strength. The focus on lower body strength aligns with evolutionary and functional needs, such as stability and locomotion. Additionally, women often utilize their lower body strength more frequently in daily activities and certain types of exercise, further enhancing muscle development in these regions. This habitual usage reinforces the natural tendency for greater lower body muscle mass. In terms of muscle anatomy, women generally have smaller cross-sectional areas in their upper body muscles compared to men. This anatomical difference means that, even with similar muscle quality, the overall force production in the upper body is lower in women due to the smaller muscle volume. Interestingly, research indicates that women are more fatigue-resistant than men. This means that while women may have lower absolute strength, they can sustain muscle activity for longer periods without fatigue. This endurance capability can be advantageous in activities requiring prolonged exertion and highlights the importance of tailored training programs that leverage this strength. Next, let's examine the physiological responses to acute exercise, focusing on the cardiovascular differences between men and women. These differences are particularly pronounced during submaximal exercise, whether considered at the same absolute or relative workload. When performing the same absolute submaximal workload, such as running at a fixed speed or cycling at a set power output, both men and women achieve similar cardiac output. However, the way they achieve this output differs. Women typically have a lower stroke volume, which is the amount of blood ejected by the heart per beat. To compensate for this, women have a higher heart rate compared to men. This difference is partly due to women generally having smaller hearts and lower overall blood volume. When we consider the same relative submaximal workload, meaning the same percentage of maximum effort, the differences become more pronounced. Women exhibit a slightly higher heart rate and a reduced stroke volume compared to men. Consequently, the overall cardiac output in women is also reduced under these conditions. This reduced cardiac output leads to lower oxygen consumption, which can affect endurance performance. These cardiovascular differences underscore the importance of tailored training programs. For instance, women might benefit from specific endurance training to enhance stroke volume and overall cardiovascular efficiency. Additionally, recognizing these physiological responses can help in designing exercise protocols that optimize performance and safety for both men and women. Let's now focus on the sex differences in respiratory function, which are primarily influenced by variations in lung volume and body size between men and women. At the same relative workload, such as exercising at a similar percentage of maximum effort, men and women exhibit similar breathing frequencies. However, when performing at the same absolute workload, such as running at a fixed speed, women tend to increase their breathing frequency more than men. This increased frequency helps to meet the oxygen demands of their bodies during exercise. A key measure of aerobic fitness, VO2 max, or maximal oxygen uptake, tends to be lower in women compared to men. This difference is influenced by several factors. Firstly, women generally have lower hemoglobin levels, which limits the amount of oxygen that can be transported in the blood. Hemoglobin is essential for binding and carrying oxygen from the lungs to the muscles. Additionally, women have a lower cardiac output during maximal exercise, which further limits VO2 max. The stroke volume, or the amount of blood ejected from the heart per beat, is limited by the smaller heart size and lower plasma volume typically found in women. This means that even at maximum effort, the heart's ability to pump blood and deliver oxygen is less in women compared to men. Understanding these respiratory and cardiovascular differences is crucial for developing effective training programs. For instance, women might benefit from training that focuses on improving cardiovascular efficiency and increasing hemoglobin levels, such as high-intensity interval training, HIIT, and strength training. Now, let's explore the physiological adaptations to exercise training and how these adaptations manifest differently in men and women. Firstly, both men and women experience similar changes in body composition as a result of regular exercise. These changes include reductions in total body mass, fat mass, and percent body fat. Additionally, exercise increases fat-free mass, with more significant gains observed from strength training compared to endurance training. This increase in fat-free mass includes muscle, which contributes to improved overall fitness and metabolic health. Weight-bearing exercises, such as running or resistance training, are particularly beneficial for maintaining bone mineral density. This is crucial for preventing osteoporosis and other bone-related issues, especially in women who are at a higher risk of bone density loss as they age. When it comes to connective tissue injuries, research shows that the risk is not significantly different between men and women, highlighting that both sexes can benefit equally from proper training and injury prevention strategies. In terms of strength gains, women typically experience less muscle hypertrophy or muscle size increase compared to men. However, some studies suggest that with similar training programs, women can achieve comparable relative strength gains. This indicates that while the absolute increase in muscle size might be smaller, the functional improvements can be quite similar. One notable difference is in the variation of weight lifted relative to body weight. For a given body weight, trained men generally have more fat-free mass, FFM, than trained women. This greater muscle mass in men often translates to higher absolute strength and greater weights lifted during training. When comparing sport performance, it's clear that men generally outperform women across most objective standards of competition. This performance gap is particularly noticeable in upper body events, where the differences in muscle mass and strength between the sexes are most pronounced. However, it's important to note that this gap has been narrowing over the past 30 to 40 years. Women's performance in various sports has drastically improved, thanks largely to advancements in training techniques, increased access to resources, and greater societal support for female athletes. Women now train harder and more scientifically, which has significantly boosted their competitive capabilities. Despite this remarkable progress, the rate of improvement in women's performance has started to level off. This plateau suggests that female athletes are approaching their physiological limits, much like their male counterparts. The improvements we've seen are a testament to the dedication and resilience of female athletes, as well as the evolving understanding of sports science and training methodologies. While men continue to have certain physiological advantages that contribute to superior performance in many sports, the narrowing performance gap highlights the importance of equal opportunities and support for female athletes. By continuing to invest in the training and development of women in sports, we can further close this gap and celebrate the achievements of all athletes. A crucial aspect to consider when discussing sex differences in sport and exercise is the menstrual cycle and its impact on athletic performance. Despite common misconceptions, no reliable data indicate that athletic performance is significantly altered across the different phases of the menstrual cycle. Studies have shown that there are no physiological differences in exercise responses across these phases. Moreover, historical data supports this finding, as world records have been set by women during every phase of the menstrual cycle. This suggests that the menstrual cycle does not hinder peak performance, and that women can achieve outstanding athletic feats regardless of the timing within their cycle. However, one area of concern is secondary amenorrhea, a condition where menstruation stops for several months. This condition is often caused by an energy deficit, which occurs when caloric intake is inadequate to meet the energy demands of both exercise and basic bodily functions. This energy deficit can lead to a reduction in the frequency of luteinizing hormone, LH, pulses, which is crucial for maintaining regular menstrual cycles. It's important to note that as long as caloric intake is sufficient to cover both exercise and daily energy needs, exercise alone does not lead to secondary amenorrhea. This underscores the importance of proper nutrition and energy balance for female athletes to maintain both their health and performance levels. When discussing sex differences in sport and exercise, it's essential to address the special considerations related to pregnancy. Exercise during pregnancy raises several physiological concerns that need careful management to ensure both maternal and fetal health. Firstly, one of the primary concerns is the acute reduction in uterine blood flow. During intense exercise, blood is shunted to active muscles, which can potentially lead to fetal hypoxia, a condition where the fetus receives insufficient oxygen. This is a critical factor to monitor, as adequate oxygen supply is vital for fetal development. Secondly, fetal hyperthermia is another concern. Exercise increases the maternal core temperature, and if this rise is significant, it can lead to an increase in fetal temperature as well. Maintaining a safe body temperature during exercise is crucial to prevent potential heat-related complications for the fetus. Additionally, during pregnancy, maternal carbohydrate, CHO, usage increases to meet the energy demands of both exercise and fetal development. This heightened usage can reduce the availability of carbohydrates to the fetus, which is essential for its growth and energy needs. Ensuring adequate nutritional intake and managing exercise intensity can help mitigate this risk. Lastly, concerns about miscarriage and the final outcome of pregnancy are prevalent. While moderate exercise is generally considered safe and beneficial, excessive or high-intensity exercise can pose risks. It's important for pregnant women to consult with healthcare providers to tailor exercise routines that support a healthy pregnancy while minimizing risks. During pregnancy, maintaining a regular exercise routine can offer numerous benefits for both the mother and the developing baby. It's generally recommended to engage in mild to moderate exercise about 3 times a week. However, it's crucial to listen to your body and stop exercising if you feel fatigued. After the first trimester, it's advisable to avoid exercises that require lying on your back for an extended period to minimize the risk of supine hypotensive syndrome. Instead, focusing on non-weight-bearing exercises can be preferable during this time. Furthermore, prioritizing activities that pose minimal risk of falling or loss of balance is essential for ensuring safety. By following these guidelines, expecting mothers can maintain their fitness levels and promote overall well-being throughout pregnancy. Ensuring a healthy pregnancy involves more than just exercise. It encompasses various aspects of self-care and safety measures. Here are some key recommendations. Firstly, maintaining adequate caloric intake is crucial to support the increased energy demands of pregnancy and the demands of exercise. Proper nutrition is essential for the health of both the mother and the developing baby. Secondly, it's important for expecting mothers to dress appropriately and stay hydrated during exercise to prevent heat stress. Wearing loose, breathable clothing and drinking plenty of water can help regulate body temperature and prevent overheating. After childbirth, gradually resuming your pre-pregnancy exercise routine is advisable. However, it's essential to listen to your body and not push yourself too hard, especially in the early postpartum period. Slow and steady progress is key to avoid injury and support the recovery process. Additionally, it's recommended to avoid activities with a high risk of injury or complications during pregnancy, such as scuba diving. While exercise during pregnancy can offer numerous benefits, it's important to weigh these against potential risks and approach them cautiously. In summary, by following these recommendations, expecting mothers can promote their own health and well-being, as well as that of their baby, throughout pregnancy and beyond. Osteoporosis, a condition characterized by weakened bones, is a significant concern, particularly for women, especially after menopause. Understanding how exercise and lifestyle factors influence its progression is crucial for managing this condition effectively. Weight-bearing exercise plays a vital role in slowing down and even retarding the progression of osteoporosis. Activities such as walking, jogging, or resistance training help stimulate bone formation and strengthen existing bone tissue, reducing the risk of fractures. Several factors contribute to the development of osteoporosis, including estrogen deficiency, inadequate calcium intake, and insufficient physical activity. Estrogen plays a key role in maintaining bone density, so its decline after menopause can accelerate bone loss. Ensuring an adequate intake of calcium through diet or supplements is essential for maintaining bone health. Additionally, engaging in regular physical activity helps to preserve bone mass and strength, reducing the risk of osteoporosis-related fractures. Other factors such as amenorrhea, absence of menstruation, and conditions like anorexia nervosa can also increase the risk of osteoporosis by disrupting hormonal balance and affecting bone density. In general, by addressing these contributing factors through appropriate exercise, nutrition, and lifestyle modifications, individuals, especially women at risk of osteoporosis, can take proactive steps to maintain bone health and reduce the likelihood of fractures. When it comes to managing osteoporosis, there are several treatment and preventive options to consider. Let's explore some of them. Estrogen therapy was originally prescribed to reverse osteoporosis by helping to maintain bone density. However, it's important to note that estrogen supplementation carries certain risks, including a higher likelihood of cancer, stroke, and heart attack. Therefore, its use should be carefully evaluated and monitored by healthcare professionals. Bisphosphonates are a class of anti-resorptive medications commonly used to treat osteoporosis. These medications work by slowing down or stopping the breakdown of bone tissue, thus helping to preserve bone density and reduce the risk of fractures. Bisphosphonates can be an effective treatment option, but like any medication, they may have potential side effects, so it's essential to discuss their use with your healthcare provider. In addition to medical treatments, preventive strategies play a crucial role in managing osteoporosis. A balanced diet rich in calcium and vitamin D is essential for maintaining bone health. Foods such as dairy products, leafy greens, and fortified cereals can help increase calcium intake. Likewise, exposure to sunlight and supplementation can aid in obtaining sufficient vitamin D. Regular physical activity, particularly weight-bearing exercises like walking, dancing, or strength training, can help strengthen bones and reduce the risk of fractures. Additionally, maintaining amenorrhea, regular menstrual cycles, is important for hormonal balance and bone health in women. By incorporating these strategies into your osteoporosis management plan, you can take proactive steps to maintain bone strength, reduce fracture risk, and improve overall quality of life. Eating disorders are complex mental health conditions that can have serious consequences for physical and psychological well-being. Let's delve into two of the most common eating disorders. Anorexia nervosa. This disorder is characterized by a refusal to maintain a minimal normal weight, often accompanied by a distorted body image and an intense fear of gaining weight or being fat. Individuals with anorexia may severely restrict their food intake, engage in excessive exercise, and exhibit other behaviors aimed at weight loss. Amenorrhea, or the absence of menstrual periods, is a common symptom in females with anorexia due to hormonal imbalances caused by malnutrition. Bulimia nervosa. Bulimia involves recurrent episodes of binge eating, during which individuals consume large amounts of food in a short period while feeling a lack of control over their eating behavior. These binge-eating episodes are typically followed by purging behaviors such as self-induced vomiting, misuse of laxatives or diuretics, or excessive exercise. Unlike anorexia, individuals with bulimia often maintain a relatively normal body weight, but they may experience fluctuations due to the cycle of binging and purging. Both anorexia nervosa and bulimia nervosa are serious conditions that require comprehensive treatment, including medical, nutritional, and psychological interventions. Early detection and intervention are crucial for improving outcomes and preventing long-term health complications. If you or someone you know is struggling with an eating disorder, it's important to seek support from healthcare professionals who specialize in eating disorder treatment. Recovery is possible with the right treatment and support network in place. Eating disorders are complex conditions that can affect individuals of all ages and genders, but young women are at the highest risk. It's crucial to understand the distinctions between an eating disorder and disordered eating, as well as the impact of certain sports and challenges in reporting prevalence. While eating disorders can affect anyone, young women, particularly adolescents and young adults, are at the highest risk. However, it's important to recognize that eating disorders can occur across diverse demographics, including men and individuals of various ages. Eating disorder versus disordered eating. It's essential to differentiate between an eating disorder, which involves severe disturbances in eating behavior and related thoughts and emotions, and disordered eating, which may involve irregular eating habits but does not meet the criteria for a diagnosable disorder. Both require attention and support, but the severity and impact on health may differ. Sports and risk factors. Certain sports environments can exacerbate the risk of developing eating disorders, particularly those that emphasize appearance, endurance, or weight classes. Sports such as diving, figure skating, ballet, distance running, swimming, jockeying, boxing, and wrestling may foster conditions where athletes, often perfectionists and highly competitive, feel pressured to maintain specific body shapes or weights. Challenges in reporting. It's important to note that self-reporting of eating disorders often underestimates their prevalence due to stigma, shame, and fear of judgment. Many individuals may struggle in silence, making it challenging to accurately assess the scope of the issue. Seeking specialized help. If you or someone you know is struggling with an eating disorder or disordered eating, it's essential to seek out a trained clinical specialist in eating disorders. Treatment should be comprehensive, addressing medical, nutritional, and psychological aspects to promote lasting recovery. By understanding the risk factors, nuances, and challenges associated with eating disorders, we can work towards creating supportive environments and accessible resources for those in need. Environmental factors such as heat stress, cold stress, and altitude can have significant impacts on physical performance and health. Let's examine how these factors affect individuals, considering gender differences and physiological responses. Heat stress issues. In hot environments, individuals, particularly women, may experience reduced sweat production compared to men. However, there are no significant sex differences in thermal tolerance, meaning both men and women can adapt to heat stress similarly with appropriate acclimatization and hydration strategies. Cold stress issues. Cold environments present unique challenges, with women often having better insulation due to higher levels of subcutaneous fat. Conversely, men may exhibit better shivering thermogenesis due to higher levels of fat-free mass. These physiological differences can influence how individuals respond to and tolerate cold temperatures. Altitude stress issues. High-altitude environments pose challenges such as decreased oxygen availability, leading to reductions in VO2 max, a measure of aerobic capacity. However, there are no significant sex differences in altitude tolerance, indicating that both men and women can adapt to high altitudes with proper acclimatization and training. Understanding how environmental factors impact individuals differently based on gender and physiological differences is crucial for optimizing performance and minimizing health risks in various settings. Whether it's managing heat stress during exercise, staying warm in cold environments, or acclimatizing to high altitudes, proper preparation and awareness of these factors are essential for maintaining health and performance. As we come to the end of our session, let's take a moment to reflect on the valuable insights we've gained today. From exploring sex differences in sports and exercise to understanding special issues like osteoporosis, eating disorders, and environmental factors, we've delved into critical topics that shape our approach to fitness and well-being. Remember, the knowledge you've acquired here isn't just about understanding concepts, it's about applying them. By recognizing and respecting the unique physiological differences between individuals, we can tailor our strategies for optimal performance and health outcomes. Thank you for your engagement and participation. I look forward to our continued exploration of these important topics. Until next time, stay inspired and keep moving forward.